We are here to talk about pulmonary hypertension, which is a very important disease to be discussed. And the public is generally very unaware of this disease. So our team has just decided to create more awareness regarding this important disease. Pulmonary hypertension is a general term which is used to describe high blood pressure that affects the blood vessels or the arteries in the lungs and the right side of the heart from any cause. This is actually a different problem than high blood pressure of the whole body, which we call as systemic hypertension, or generally known as blood pressure, in the layman language. So there are 5 different groups of pulmonary hypertension that are based on different causes. Different types of pulmonary hypertension will require different treatment. In one form of pulmonary hypertension called as pulmonary arterial hypertension, the blood vessels in the lungs are generally narrowed and they get blocked, and they get destroyed. So the heart has to generally pump against this resistance and this narrowed blood vessels, and that is how the right heart fails. Coming on to the incidence and the prevalence, the exact incidence of this disease in India is not known. However, the studies done in the West, such as done in the US, show that generally around 7 to 10 persons per 10 lakh population have this disease. In the largest study which was done, which is the REVEAL study, the incidence in the general population per million per year was around 2.3, and it was 12.5 was the prevalence per million per year. So probably we estimate that the incidence and the prevalence is the same in India. Talking about the signs and symptoms of this disease, in the early stages there are no specific signs or symptoms. However, as the disease progresses, the pressure in the lung increases, which further puts this additional stress on the heart, and these complaints generally progress over a period of 2 to 3 years. So the patients would present with complaints such as shortness of breath, and increased dizziness, and fatigue on exertion, and feeling of giddiness, and feeling like syncope, and actual syncope, and chest pain you can have, and palpitations in the later stages. Palpitations as in you feel that your heart is pounding at a higher pace, and you can have swelling of the feet, and in certain cases you will have your lips and your fingers turn blue. Coming on to the risk factors, generally we have pulmonary arterial hypertension being diagnosed in the younger population, and more commonly in females. So the prevalence is more in females in a ratio of around 3:1. So a lot more females get diagnosed with pulmonary hypertension vis-a-vis males, and however the clinical profile in males is more sinister and more serious, and even the prognosis is worse in men as compared to females. So additionally, you can have this disease present in patients who have a family history of this condition, and use of certain drugs like cocaine and methamphetamine, and in other conditions such as babies born with congenital heart defects which have not been recognized and which have not been corrected, and patients with liver disease and with HIV infection. So coming on to the part where you diagnose this pulmonary hypertension. So like I said before, pulmonary hypertension is a broad term, and is a broad umbrella term under which you have subcategories. So diagnosis is like extremely important, as in your doctor should actually spend time in conducting these examinations and these tests for you, and coming to the correct subcategory of pulmonary hypertension, because the treatment would differ according to the subcategory and the subtype. So the diagnosis is generally done after several investigations, and if not, you can get misdiagnosed as just a routine case of asthma. Like I said, this disease presents with at times a lot of vague complaints like breathlessness on increased exertion, and it can get undiagnosed for a pretty long time, like around 2 to 3 years as it progresses also, and patients might sort of neglect this condition also. Okay, so finally, the most important message that I would like to give here is that there is no cure for this disease, and the main purpose of the medication, of all the medications which are available, is to reduce and delay the progression of the disease, and this medication needs to be taken lifelong, and is relatively expensive, this medication in India. And a second very important message is that females with this condition should note and avoid pregnancy. That's all from me. Thank you.